According to the 2019 Annual Business Survey, approximately 18.3% or 1 million of all U.S. businesses were minority owned, and about 19.9% or 1.1 million of all businesses were owned by women. This program series titled Lessons Learned from COVID-19, The Survival of Minority Businesses is developed by One Joshua Group in partnership with the National Black Nurses Foundation and Meharry Medical College. The series, sponsored by AstraZeneca, is developed to discuss the impact of health equity and health disparities on minority populations, especially businesses where the undue burden of disease caused disproportionate burden on economic and health status of this vulnerable population, and specifically the recent COVID-19 pandemic. This initiative brings new and innovative contributors and partnerships to improve health outcomes where consumers work and address strategies about environmental factors such as where consumers live, play, and worship. The benefits of this collaboration allow participants to achieve more together than they can individually, serve larger groups of people, and grow on individual and organizational levels. The information provided through this partnership will inform healthcare policymakers and the healthcare delivery system about the need to reduce health disparities in a population that is now invisible while contributing to the economic and financial stability of this business community. One Joshua Group is grateful to include participation of the Carolinas, Virginia Minority Business Supplier Development Council for this first episode of the series. Please join us in welcoming our distinguished panel of experts.
Thank you so much, Mr. Watson. It's been exciting listening to the work that you guys are working towards in terms of building the capacity in your businesses. And today we want to turn our attention to the impact of COVID-19 on the survivorship of minority business. We are the National Black Nurses Foundation. This presentation is done in collaboration with Meharry Medical College and One Joshua Group. Today, we're going to start by introducing you to the broader scope, which is the impact of not just only COVID-19, but chronic diseases on the capacity, the workforce, and the energy that is stimulated from minority businesses in our communities. And so today, we know that COVID-19 and other chronic diseases have produced an unusual burden on our community and on small businesses. And towards that end, we've been trying as a consortium to look at ways to help alleviate some of the to provide good information, at the same time, talk about some of the opportunities for invigorating those minority businesses. While we know that the situation is long-standing, it doesn't make it easy. We know that the impact on minority business is disproportionate, and that we know over time with COVID-19, there has been a 40% impact on the growth of small businesses and the survivorship. So at the close of this activity, we're hoping that you would take away two things: some interesting marketing strategies for improving the penetration of businesses and to around your customer base, as well as looking at how those businesses can align and live through and survive COVID-19 and apply some strategies that are low-hanging fruit while looking at much more complex issues and approaches around how we work with individuals who come to work in our companies that have issues around COVID-19 and other chronic diseases. And finally, we hope that you will have an understanding about the impact of the clinical and economic factors of COVID-19 and other chronic diseases on the workplace, and look at the long-term effect of lost production hours and daily days lost around diseases that come into the workplace that you deal with every day. I'm now going to turn our attention to Alicia Georges. Dr. Georges is the president of the National Black Nurses Foundation and currently serves as the chair of the Board of Trustees. Dr. Georges.
Good evening. Thank you for that warm welcome, Dr. Matthews Juarez. And thank you to you, Ms. Milton, and your team for allowing us the opportunity to share with you some of the issues that have arisen and some pointers and some information that we can share with you and minority business in this country. I just want to be very brief, but to say to you that as a practicing registered nurse in the city of New York and as an academician, you must remember that we in New York City was the epicenter of COVID-19. I happen to live in the Bronx, where we are a minority borough. Definitely, Ms. Milton is from New York City, but definitely, minority businesses were so adversely affected by COVID-19 as it ravaged our communities in the borough of the Bronx and in New York City. So let me say to you, as a person who prepared those frontliners in the institutions that were providing services to the community, we also took a hard look at what was happening in our neighborhoods. Our places of business were closed. Our frontliners were not able to also have the benefits of having the businesses open in their community. What COVID-19 did was not just to the individuals, but how it affected the economics in our neighborhoods, not just in New York City, but across this country. So we in the National Black Nurses Foundation, with our partners at Meharry Medical College and the One Joshua Group, wanted to share with you a perspective of what we believe that you and your members should know as we continue to work through this pandemic and to bring our communities back to life economically and physically and in a much more healthy manner as we again fight this pandemic called COVID-19. So thank you for partnering with us, and we welcome the conversations that will go on.
Thank you so much, Dr. Georges. Now we're going to turn our attention to what is exciting about this workshop. And it tells us a lot more about COVID-19 and the impact that it has on our minority businesses. I would like to take this opportunity to introduce Dr. Philip Duncan. Dr. Duncan is a cardiologist. He is from a Jamaican immigrant family. He was raised in Harlem, New York. He understands the commitment that must be made to health and education for all of our communities. He recognizes that communities are not monolithic, that they are culturally without boundaries, that we want our businesses to serve everyone and to provide the products that are needed and necessary. And so when we look at the work that Dr. Duncan is doing, with his passion for education, for writing, and for research, he's also looking at those chronic diseases that have impacted the patients, the individuals, the community folk who would come and into our businesses, but most often we're looking at those individuals who we employ. So I'm going to introduce you to you now. Hopefully it will not be your last time for Dr. Duncan to share with you the impact of COVID-19 on the economic and social impact here among minority businesses, and later talk about how we see a way forward for survivability. Dr. Duncan.
Thank you so much, Dr. Matthews Juarez, and also Dr. Georges, and I want Dr. Georges and Sheila knows this. I grew up in the Bronx, born in Harlem, grew up in the Bronx as well, so I know that very well. Grew up in the 10466. To approach the whole concept of what COVID-19 has done to us, how it has ravaged our communities throughout the country, but especially our minority communities and affected those of us in healthcare. We have to look at it in several realms. The first, of course, is what the effect of acute COVID. And I know those in the Bronx, those in New York know it. We felt it here as well. In Central Virginia, where I am, and we know there was fear, there was tremendous illness, and there was a tremendous amount of misinformation, poor information, just things that we didn't know when we went into this. We know the acute effects of the disease, but what I'm tasked with today is to look at the effect that COVID had on chronic disease, the chronic disease that COVID has caused, as well as the impact that it has had on those of us in small businesses and also those of us in healthcare. So first, let's talk a little bit about what's happened. One is, we know about the folks with severe disease, but we know that there are folks who have what we call COVID long haul symptoms. And that is, the effect of that at this point has been significant. We don't know how long it's going to last. We know it can go from anything from, mild breathing abnormalities, muscle aches and fatigues. In the physical realm, some people have persistent loss of smell even after a while. But also when we look at neurologically, folks that have been affected by COVID will often have neurocognitive disorders, so memory loss, mood change, and even more significantly than that is the fact that in the age of COVID over the last 2 years, there's been a tremendous increase in the number of Americans in general that are complaining of anxiety and depression. Greater than 50% of the population in several surveys, and this has disproportionately affected certain communities. The fact that there also has been an increase in alcohol use and other substance abuse has also ravaged a number of communities. And one of the things that I found in the course of working through this is that when we talk about folks with COVID, we have to remember that for me as a provider, that's my patients, but this is also our workforce. As a provider of healthcare, I recognize that COVID has significantly diminished the workforce available to provide high quality care. And as a minority business owner, I recognize that we have been dealt this dual responsibility, not only of trying to manage our businesses, but also understanding that we also have another mission that we have to consider as we do what we do. So the effect of COVID itself, acutely, chronically, long-term, has in fact been pretty significant. And the truth be told, we don't know how long that is going to last. The effect that COVID has had on even those who have not suffered COVID is even more significant. So during this period of time, what we've seen is people have avoided coming to the hospital or to see their doctors. After so many months of this, with the overwhelming change in lifestyle and habits and depression, we've seen people neglect positive health habits. So we've seen a significant increase in obesity, poor control of hypertension, which had been an issue. And now what I'm actually seeing myself in the hospital is more and more admissions for the things that happen as a result of that: kidney failure, heart failure, folks coming in with strokes and heart attacks, especially young folks. That is particularly damaging because, again, these are things that we're going to see going forward that are going to can affect us for the next several decades. I look at this though as there's another side to this, which is there also is an opportunity, because one of the things that COVID has done to us is help to uncover or shine a brighter light on certain issues that we knew were affecting us before but had not addressed. So attention to managing the chronic issues that burden us, especially for me, cardiometabolic disorders, which is, I call it the 4 horsemen of the cardiometabolic apocalypse, which is hypertension, diabetes, abnormal cholesterol, and obesity. It's caused us to focus on these because we know that it increased the risk of people developing COVID. We know that folks who had these diseases did more poorly with COVID, and we know that they did not take care of themselves as well during this period of time. And now we want those folks back in functioning at the highest level and working, and all of them aren't available. But it has provided an opportunity for us to look at those things and look at them on a more global level. It's causing us to look more closely at things like population health. How do we manage large communities with these chronic diseases, because we know they are an essential part of our workforce. It has caused great advances in the area of telemedicine, telehealth, and it's made us look more closely at some of the approaches we've had to treating patients in terms of treatment algorithms that might ultimately make our treatment a lot more efficient and effective, so that we can actually see better outcomes. So while, again, as a healthcare provider, I have to say, don't know where this is going to end up ultimately as we look at the effects of long haul syndrome. I am hopeful that we can take the lessons that we've learned from COVID to improve our overall healthcare. And I also look at it because of the significant drain in the healthcare provider workforce. I hope that it has created an opportunity for some of our younger folks who might not have thought of careers in healthcare to move into that space. I'm going to stop there, leave a little time, because I know we ran a little over, and hopefully there's some questions as we go forward.
Excellent. We thank you so much for that presentation. We're now going to turn our attention to the questions in the chat box with One Joshua Group, Mr. Kermit Payne. Mr. Payne, it needs no introduction. If you think that this was an exciting presentation, it's because Mr. Payne is a connector. He knows everybody, everything, and he is quite an intellectual and a community scholar, that he allows us to come in and out and to raise the bigger questions. And so I defer at this point to Mr. Payne as we begin to look into the chat box and to start the discussion. Mr. Payne.
Thank you, Dr. Matthews Juarez. And while we're giving gratitudes, I'd like to, first of all, acknowledge Ms. Milton in her vision and transformation. As a member, an affiliate member of the Carolinas, Virginia Minority Supply Development Council, this is a great opportunity to do just what Ms. Thorne has talked about, and that is employ the issue of networking to improve your business and to look at those issues around technology. There's no better place to do that than to utilize the services of this council and the other councils. I'd also like to commend Jason and Sarah and Troy for giving us very important information about survival and restoring post-COVID. But most of all, for the council for allowing us to share this very important information about COVID-19 and its chronic diseases, as how it improves business profitability, especially in minority businesses. And this is a real concern of the health and the wellness, both physical and economic. Again, under Dominique and her staff's leadership, this is indeed an innovative and transformational opportunity. And the National Black Nurses Foundation, in partnership with Meharry Medical College and the One Joshua Group, developed this program just so we could have a candid conversation about COVID-19 and its related sequelae. We refer to some of the questions that we can go to the panelists in the chat room. Ms. Milton asked about what should we be doing, Dr. Duncan, to help our employees and protect our employees around the effects of COVID-19 and its relationship to being productive. Dr. Duncan?
Well, and that was an excellent question. And one of the things that we've seen with COVID is that the basics actually work. If we look at the experience that they had, different society, different approach, but in Wuhan, in the original province, where they shut things down because in that system they could. But what we found is that when you did, aggressive testing, contact tracing, physical distancing, masking, sanitation, we found that that did not allow the virus to spread, and that was reduced. For us, a different type of population, different society, but to the degree that we can do those things, they work. And most importantly, while the vaccines are not perfect, we know they're very effective at reducing the risk of severe COVID and death from COVID. We know that the immunity wanes, and so we have to be revaccinated where appropriate, get boosters where appropriate, and if another vaccine comes along, we need to get that. At the end of the day, virus doesn't care. The virus is no respect for personal position. So those are the basic things that will help us to get past this pandemic.
Long term, Mr. Payne, the issue of living life a little different is going to be really important. Being able to, as an employer, as an employee, as a community person, deciding, what we will do, how we will do it, whether social distancing and masking and other things would work. But that is going to be, as Ms. Milton raised in the chat, a way forward. We're going to have to think of doing things differently because this virus will be with us for a long time.
Dr. Matthews-Warres, we're not going to let you off of the hook here, because there's a lot of other information that you and your colleagues are working on in this same arena about addressing COVID and other chronic diseases in small business. I do know that in a current consortium where you're working, you are specifically addressing this issue. Tell us what you're doing in Tennessee and some of your projects, and here in the state of Georgia, where we're looking specifically at increasing participation as a recovery process from COVID-19.
Well, we're educating employees. We're going to large companies such as Amazon.com. We're talking to the employees on their break. For hospitals, we are actually going into the hospitals and talk. Believe it or not, health professionals do not participate as often and as largely as we want. So we educate. We also go to health fairs, and we bring our businesses with us to share with the community what it is that needs to happen, whether it is information about COVID-19 or how to stay safe, or whether or not you want to bring your children. We also go to schools. So it's an all out infrastructure move to fight this pandemic on its own grounds. And I think that's the issue, Mr. Payne, is taking the fight to the virus. But be careful so that you know that you have to do all the things to stay safe while you're fighting.
Greg mentioned something, and Dominique referred to the same concern as did Dr. Georges and Ms. Thorne and Dr. Matthews-Juarez. We're going to have a new workforce. We're going to have to create a new workforce, as Dominique mentioned, post-pandemic. This is a great opportunity for MBEs to look at unusual partners, people they may not have worked with in the past, to see how we can improve the opportunity through recovery, utilizing some of the information that Jason provided around funding, looking at some of the ways of responding to RFAs, and knowing that many of these RFAs are going to look very differently than they looked pre-COVID. Being a minority business enterprise is a plum now in the post-pandemic era. The number of opportunities that are going to be raised. So we would look and ask, continue to be supported by the council in where those opportunities take place. Dr. Georges, in terms of workforce development, did you have any concerns or any areas you'd like to address to help us look at some of the post-COVID opportunities for recovery of small business?
Yes, I do. I think that one of the things that we've been talking about, and it's been bandied around in the country from all different kinds of groups, we're going to have to take a hard look at the kinds of workers we have within our small businesses. And how can we utilize the skills that they have to give information to communities?
Right.
So you may want to call it a new kind of worker, somebody who's really, really deep in community, and who can then begin to share with the persons that they provide services to. For instance, I will tell you, I live in a West Indian neighborhood. We got more restaurants than anybody you want to see. And one of the key things is each time I go into the places, I am always fascinated because they know I'm a nurse, and they would say things like, you know, we need to tell that man that he has to pull his mask off. We need to do this. We need to do that. We need to be doing this with our small businesses and with their workers, as Dr. Matthews-Juarez said, and as Ms. Thorne, and as Dr. Duncan clearly identified. We have got to teach the people who are on the front line, who are providing services into our community, of what they can do to keep our communities healthy. And that means healthy businesses, healthy workers, healthy communities. And if we can do that, and we may have to rename workers, we may have to call them something else, it may have to be multitasking, but this is something new. It's a new horizon. This is something new we're going to have to look at.
So all of the panelists, Dominique has a very prolific question, and that is, what can we do as business owners? That's all of us. What can we do as business owners to educate our customers and our communities to get on board with the health prep?
I start out by saying, you know, if we practice what we preach, then we don't have to preach so much what we practice. So we start out by being a good example, and that's number one. So, you know, and sadly, I know even some of my colleagues, other healthcare workers, have skepticism over what clearly works. So that's number one. You know, we have to be good examples. And then we have to recognize, you know, my grandmother used to say you can draw more flies with honey than you can with gall. And so we have to tailor our message when we talk to folks so that people hear what we're saying. Those are the things that I think are exceedingly important if we want to change behavior, not just continue arguments.
I'm going to take a page from Dr. Duncan. and that is plan your work, work your plan. And that means that if you can't afford a Miss Thorne, then develop a marketing strategy that creates a YouTube page for yourself, or to make sure you brand who you are, but make sure that the employees that you have also know what the brand is, and that they trust you and you can offer trustworthiness to your community. And that is, if your community has several different population, get several different flyers in the languages that your community, that your small business is in. Make sure that your staff, your employees give those out, and or create a website where they can go and get that information. But most importantly is that you develop a plan for sustainability, that no matter what, you're going to stay, because we need you to stay. You're the essence of what it is. You're like the Black church. And we do work with the Black churches. So I think that plan your work, work your plan, include all the things you've heard, and to the extent that you can reach out to experts that can be at your shop talking about this, create a day where you can participate in COVID-19 activities, whether it's inviting a group in or inviting a nurse in. Do that. Your nurse is your best friend. We always trust nurses. We don't always trust someone else who's going to give us a shot, but we will trust a nurse to give us a shot, won't we, Georges? We also trust Dr. Duncan too to give us a shot. So that's my recommendation, Mr. Payne, and I'll turn it over to Dr. Georges for the last word.
I just have to leave you with some parting words about, do not forget, your approach should be intergenerational, because everybody has been affected by COVID-19 in our communities. The older person, who in many instances are some of your best customers, have been so affected, but so have the young people, and so have their parents and their caretakers. So any approach we use, look at how we can bind the generations, because you see, together, they are very powerful. They have different approaches, like Ms. Thorne mentioned, where they only want social media, and the phone is their biggest thing, and what we can do with a telephone. And then we have the older generation, I'm not talking about myself, but we have the older generation who depend on a mixed media, the phone, but, written word, and the trust of those community groups that they have always been a part of. So that's my parting words to you, but don't forget, across the generation.
Thank you so much, Greg, for moderating this evening. And thank you to all of our attendees who invested the time to be here today to learn. I always say, as Greg said earlier, you have to be at the table to partake and to grow and to eat, right? And so we have learned today. You took part in the buffet. The knowledge that was shared today was shared for the first time for many of you, right? So you learned about how invoices are going to be purchased by Facebook, now Meta. You learned about microloans from the BCF at NMSDC. You learn how to write an RFP, how to respond to an RFP, really to decide whether or not you want to partake in that RFP. So that was really powerful from one of our very, very high-level MBEs. And then you learned about how to understand your employees, what they might be going through, how we can really impact change given the COVID situation, and how we can, change our communities, right? Because we are the lifeblood of our community as minority business owners. When we shut down, it impacts the economic stability of our community. So all of this learning today has been powerful. We really stepped outside the box with some new learnings. I want to thank the One Joshua group for being here. Kermit, you delivered. You just brought an A-list of talent to the table so we can learn from them. So I just want to thank each of you for being here today. And stay tuned for session number 3, which will occur in January. You have to register for that session number 3. It is free. Again, this is brought to you by Wells Fargo. So thank you for being here, and I look forward to seeing you all in January. Have a happy holiday. Take care.
We hope you enjoyed the program titled Lessons Learned from COVID-19, The Survival of Minority Businesses. This public, private, academic, and business-centered partnership was developed to provide an overview of the healthcare needs of minority employees who work and reside in minority communities while supporting the economic stability of the minority business community. We believe the information provided through this partnership will inform healthcare policymakers and the healthcare delivery system about the need to reduce health disparities in a population that is now invisible while contributing to the economic and financial stability of this business community. One Joshua Group thanks the National Black Nurses Foundation and Meharry Medical College for their partnership and AstraZeneca for their support. We greatly appreciate the Carolina, Virginia Minority Supplier Development Council for its visionary leadership in sharing this information with their minority business enterprise as we work together for a healthier and productive diverse workforce and contribute to the financial stability of our nation. Thank you again for joining us. Read more about our work at theonejoshuagroup.com.